Hello, my name is Linda Wu, and I am a Community Bridges Fellow in Rice's Kinder Institute for Urban Research. As an intern with Legacy Community Health this past semester, I'm excited to talk with you about my project, Assessing Student Health Advocates' Readiness to Manage Intimate Partner Violence. First, to provide some context, Legacy is Houston's largest federally qualified health center that provides care to underserved patients in disadvantaged neighborhoods. Legacy strongly believes in providing holistic care, so they have a social determinants of health program where student health advocates, also known as HOSIs like me, help connect low-income patients with various social resources. Intimate partner violence, which is IPV for short, is also a major factor impacting health, and at Legacy, the medical assistants screen all patients for IPV. However, if a patient were to disclose such information to a HOSI, the HOSI would also make a social service referral. The healthcare system and care teams like the one at Legacy are critical sites for IPV intervention, but studies have found that healthcare providers often face difficulty in addressing patients' IPV cases. Because HOSIs are also a part of the care team that works directly with patients, I was curious to assess how prepared HOSIs felt when working with patients experiencing IPV. And so, from administering a questionnaire to the 43 health advocates on the team, I conducted a comparative analysis and found that female HOSIs were significantly more comfortable and prepared to address IPV in patients compared with male HOSIs when asked the following two questions displayed on the graph. From these findings, I was able to identify three areas where Legacy could improve to further their mission of providing holistic care to their patients. One, in the HOSI training. They can emphasize the IPV workflow and acknowledge biases contributing to the gender disparity and readiness to address IPV. Two, in data collection. To gain a stronger understanding of IPV in the patient population, they can establish a system to collect data on IPV reports from medical assistants and HOSIs. And three, in future research endeavors, such as the ones listed on this slide. This could help them identify future areas to intervene and support patients experiencing IPV. Overall, this project also has many implications for the larger picture of urban inequality in Houston. This project identified a significant gender discrepancy in HOSI's preparedness to address IPV cases. With more male HOSIs feeling unprepared, many patients experiencing IPV may go unnoticed. This gender difference may be reflected in other healthcare professions beyond just in HOSIs at Legacy's clinics. In fact, the physician workforce, which is male-dominated, may be experiencing similar discrepancies, leaving more IPV cases unaddressed in at-risk populations. The resulting socioeconomic and health consequences perpetuate patients' risk of IPV, which furthers urban inequality in disadvantaged neighborhoods. Overall, more research needs to be done examining this gender difference, and in an area like Houston, where high rates of poverty, racial and socioeconomic segregation, and urbanized social isolation easily exacerbate the consequences of IPV, it is particularly important to identify the gaps in our healthcare system where vulnerable members in our community may fall through the cracks. Thank you so much for listening.